I've chosen to do my presentation on ADHD. This is because I've only ever had one student that I taught with ADHD, and it was only for a short period of time. I didn't feel like I learned enough within that small period of time, so I really wanted to learn more. ADHD is among the most common brain disorders developed during childhood. It is mainly diagnosed in school-age children, but can be diagnosed in adulthood as well. There are 3 types of ADHD, and these include inattentive, hyperactive, and impulsive, and a combination of the two. I feel like in the last 10 years, ADHD has been diagnosed more often, and which means I feel like it's been misdiagnosed quite a bit just because some people after ADHD started becoming more well known, they would look at a child with an abundance of energy and just think, oh, maybe they have ADHD. We need to calm them down with medication. But instead, they're just a child being a child and just they have loads of energy. ADHD does not have one specific known cause, but there are multiple factors that may contribute to a child having ADHD. Some factors include genetics, sustaining a brain injury, exposure to lead, maternal use of tobacco and alcohol while pregnant, being delivered prematurely, and being not fully developed when born due to either being premature or other issues during development.
Attention Deficit Hyperactivity Disorder, or ADHD, is a condition that causes both kids and adults to be easily distracted, fidgety, and impulsive. What looks on the surface like a behavioral problem is actually a brain disorder that affects both the structure and function of the brain. Research has found that the brains of people with ADHD are smaller in certain areas, especially in the frontal lobe, affecting impulse control, concentration, and inhibition. Brain development is also slower in people with ADHD. The neural pathways don't connect and mature at the same rate, making it harder to pay attention and focus. This can impair executive function, which handles organization and routine tasks. ADHD impacts brain chemistry too. People with ADHD may have problems processing dopamine, a chemical linked to movement, sleep, attention, and learning. ADHD can be tricky to diagnose and challenging to manage, but there are treatments that can help. Consult with a doctor for all your questions about ADHD.
Now, I do want to apologize for that recipe coming up on the video. It comes up each time. I don't know how to stop it from coming up, but I felt like the video was very informative and I still wanted to include it anyway. Different signs of the 3 types of ADHD can include a student who daydreams often, does not have organizational skills, talks too much, takes risks, acts impulsively, and constantly moves around, almost like they have ants in their pants. These are only some examples of what ADHD in children might look like, but just because a child exhibits one or more of these does not guarantee they have ADHD.
Is an iceberg. According to Chris A. Ziegler, Dendy, just 10% of its complex symptoms are visible to the naked eye. Most teachers recognize hallmark signs like hyperactivity, impulsivity, inattention, but its lesser-known invisible challenges are easy to blame on laziness or disobedience. Use this guide to explain beneath-the-surface ADHD attributes that are commonly misunderstood at school. 1. Developmental delays. Kids with ADHD mature at a slower pace. Their brain development can lag 2 to 3 years behind their peers. A 15-year-old with ADHD may act like a 12-year-old socially and emotionally. 2. Impaired executive functioning. Executive functions help kids plan, prioritize, and execute daily tasks. When they are weak, students have trouble with remembering homework or the rules, keeping track of due dates, getting started on boring tasks, sticking with difficult projects, and retrieving facts or information. 3. Emotional dysregulation. ADHD impairs a child's ability to regulate feelings, anger, anxiety, or sadness. Students with ADHD may have overblown reactions to setbacks that seem small and then struggle to calm down. 4. Coexisting conditions. Roughly half of all students with ADHD also have a second condition, like a learning disability, anxiety, depression, or oppositional defiant disorder. The first step towards greater learning is a comprehensive diagnosis and more complete understanding.
Some ways to help students with ADHD succeed in their education include a good classroom management technique, an IEP or 504 plan, and accommodations. At the school intermediate unit where I work, we have a school-wide positive behavior system. Each classroom teacher keeps track of the students' behaviors and what level of the system each student is on. The levels are 1 through 6, 1 being the lowest and 6 being the highest. When a student starts school at the IU, they start on level 1, day 1, and work through the year to reach level 6. The best case scenario is for each student to stay on level 6 and not go back a level. Each Friday, we have what is called rewards. This includes swimming, a movie, or activities in the gym for the students who are on the levels required to earn rewards. And sometimes we even have like a carnival that happens each May now where the students get to play games and win small and inexpensive prizes. And there's different fun food that they can have besides just the regular school lunch. And the kids that are on the levels that are required get to attend, and usually the whole school and all the students get to attend. It's just the students that have more extreme behaviors, more severe behaviors that have been happening more frequently during that time. Some examples of accommodations to help students with ADHD who struggle with inattentiveness include breaking assignments into smaller parts, also called chunking, keeping the instructions clear, providing extra time, a visual timer, organizational tools, and the use of technology. Some examples of accommodations to help students with ADHD who struggle with hyperactivity and impulsiveness include a variety of seating options, reinforcement of positive behavior, using an object to keep track of who is speaking, and the use of different fidget tools. I will give some examples of fidget tools on the next slide, but I do want to mention that fidget tools are supposed to improve concentration and not distract the students in any way. A few accommodations that can assist a student with a combination of ADHD types include seating the student in a low traffic area, letting the student take tests in a separate room that's quiet and away from noise, and providing movement breaks. Fidget tools for oral use include wearable chewy items and pencil tops that are chewable. Fidget tools for hand use include fidget spinners, stress balls, and fidget blocks that are specially made. Fidget tools for whole body use include wiggle cushions, wiggle stools, desks used when standing, and giant rubber bands attached to chair or to desk legs. I have found with fidget spinners that although they are great fidget tools, they can also be a great distraction. When I first started my career a few years ago, fidget tools were just starting to come out and get big, and all the kids wanted to have one. It was okay to have a fidget tool that was a fidget spinner as long as it was a solid color or one that just had a cool design. But the ones that light up or do anything extra like that, I found it was too distracting because it was eye-catching, and then one student would look at it and then they would all kind of be distracted. And that wasn't the purpose of a fidget tool. So at that point, they ended up needing to be banned in a way. And stress balls are a great stress relief and fidget tool for a student with ADHD because it doesn't make any noise. They usually don't light up, and they can just squeeze it while they're focusing on a lesson or even while they're writing or doing something on some piece of technology. I've also found that when children stand to do some of their work, it helps them focus because they get to move around a little bit and they're not just constantly fidgeting in their chairs, which may not be as comfortable as they would like them to be. So, standing up could also be a great way for them to do their work. These are the resources I used to create my presentation. I encourage you to look at them further. There is a lot more information than what I included in the presentation just due to the amount of time that we are limited to, and I didn't want to take up too much of your time. The first and last one are the resource for the videos I included in the presentation if you want to go back and watch them without them being in the presentation. The third and fourth not the third and fourth, the second and third resource are from the Centers for Disease Control and Prevention. I found them very useful to find out what ADHD includes, as in the signs and symptoms, the causes, and the more medical aspects of it. And the third one also has a little bit of classroom accommodations that could be used. The fourth has a company called CHAD program that CDC actually funds, and they also provide a lot of good classroom accommodation and ideas and strategies. And then the fifth resource that I have on the list is a blog from a mother of a girl who exhibits signs of ADHD and how the mother has coped with them and different tools that she has found worked well and that she wanted to share with everyone else as well. I want to thank you for watching my presentation, and I hope you were able to learn something from it. I enjoyed creating it and learning more about ADHD than I knew about before. I knew a little bit about the information and a few of the fidget tools or just the accommodations that I learned could help kids with ADHD. I had already either seen from working at the IU or I've used myself just as accommodations for students who I feel like could use them, but not necessarily because of any ADHD that they may or may not have had. So thank you once again for watching my presentation, and you have a great day.